There has to be a better way to deal with this. Exploring mental health needs of women residing in violence against women shelters in Ottawa, Ontario. In 2016, Violence Against Women shelters in Ottawa reported an increase in the number of residents with mental health and substance use issues. Shelter managers approached women's mental health at the Royal for help to meet this challenge. Although the violence experienced by VAW shelter residents is highly correlated with mental health issues, women residing in these shelters do not have equitable access to the psychiatric care offered at other homeless shelters in Ottawa.
With funding from Women's Exchange and in collaboration with Dr. Angel Foster at the University of Ottawa, as well as all 6 Ottawa VAW shelters, the Royal initiated a study to examine the mental health needs of this population. An advisory group with varying experiences of mental illness, gender-based violence, and shelter use assisted throughout.
We conducted 30 in-depth resident interviews and 6 staff focus group discussions. Shelter residents completed standardized self-report mental health questionnaires. 63% reported mild to severe depression, 93% reported somatization, and 73% reported symptoms of post-traumatic stress disorder. Violence Against Women shelter residents noted that substance use, self-doubt from gaslighting, isolation, motherhood, and racism negatively impacted their mental health.
These difficulties created barriers for women accessing housing, navigating criminal or family court proceedings, engaging with healthcare providers and child protection services, as well as working and studying. For mothers, First Nation, Inuit and Métis women, and recent immigrant women, these barriers were greater and more frequent. So what did shelter staff and residents think would make the situation better?
Overwhelmingly, participants in the study wanted more mental health services for the VAW shelter sector, including access to clinical intervention for residents, as well as mental health education and consultation for staff. Shelter residents also reported that peer engagement with other women who had survived violence was therapeutic and valuable.
It is our hope that these findings can point decision makers and funders towards developing equitable access to psychiatric outreach services for women in Ottawa VAW shelters.